Hi, my name is Gail Sullivan. I am doing a project on environmental risk in vulnerable populations, specifically sexual infections in the youth. These are some slides I have just showing the youth population who are at the increased risk of contracting sexually transmitted diseases and not being able to go somewhere and get them helped. At-risk sexual behavior affects people who have a different education level and socioeconomic status. It could be racial or ethnic, depending on the location. It could also be related to religious effects. Socioeconomic status determines disposition towards the education. Family life also determines the disposition toward family, towards education on sex. The objectives are to determine a health policy that will help improve the policy on students and getting them help when they are in a crisis, such as having a sexually transmitted disease and not being able to get help for that. We'll be able to need to get the communities together to open up a dialogue in order to get this policy passed. The rationale for the project is a modeling behavior. At-risk sexual behavior is a public health risk. High occurrences of sexually transmitted infections and the increased risk of infertility due to continued risk of infection such as chlamydia. PICO, we have a problem, which is the absence of a coherent approach to the policy. Our intervention is to introduce new policies that encompass all groups of people. We want to have our comparison, which is at-risk youth, will have a quicker response to get treatments, therefore reducing the risk of passing along to someone else or having a higher risk of infertility. Our outcome is the solution is the problem. In order to do this, we have to try to accomplish lower occurrences of sexual infection. And our question will be, will the treatment and education of at-risk youth help to provide a decreased incidence of the spread of sexually transmitted diseases? So we have the evidence of change. I have a couple more slides here talking about the statistics. In 2014, 1.4 million people had chlamydia, and 1 in 4 carry the genital warts virus. As you can see from the previous slides, there's a large number of data to support that increased education is a must. Parents and guardians have to be more open to discuss this, and a better sex education opportunity comes from the higher ups. And we can promote a decrease in STIs, which will help promote a decreased risk of infertility in our youth. The evaluation, this would start by having a research of a baseline. We would do baseline studies 1 year, 2 year, 1 year, 3 year, and a 5 year. We will keep an updated list of the people who we do the study on so that we can maintain contact with them. The outcome will be having someone to talk to will help decrease the risk of someone feeling that they can't come forward. We will help make sure there's an open dialogue regarding that. And by opening this dialogue with our youth, we can help provide a safer opportunity for them. The program should begin earlier and target younger adolescents. They may not feel as pressured to have sex or be able to stand forward and say that they want to use protection when they do have sex. We must all get out there to help our youth and provide them with open arms and open ears so they have the courage to come forward. These are my references. I would like to thank everyone for coming and listening to my project. I know I'm not a very good public speaker, but I am trying to learn. So if you have any questions, please feel free to ask. And if not, we can pass the slide along and pass it along to everyone in the, we can email it to everyone in the program.